Hello, everyone. My name is Ilika, and I work in health system strengthening, supporting universal health coverage reforms across several low and middle income countries. Universal health coverage is a big passion of mine, but personally, because through this work, I've come to deeply understand the importance of saving and changing lives through purposeful and effective reforms, especially when we elevate the voices of those who are mostly affected by these reforms. A wise man once said, insanity is doing the same thing the same way and expecting a different result. And this realization brings me to the focus of my project, which is titled Doing Things Differently, Transformational Partnerships for Achieving Universal Health Coverage Reforms in Africa. Young people are the major users of health services in Africa. Globally, they make up nearly 50% of the population in Africa. Over 60% of them are under the age of 25. Yet, fewer than 3% of governments meaningfully engage young people in policy processes. And this disconnect matters. Evidence has shown that youth inclusion improves policy relevance, accountability, and sustainability. And this is particularly important when reforms target areas that affect young people. In Africa, over 60% of the population are under the age of 25, and yet young people remain largely absent from decision-making spaces that shape universal health coverage reforms. Many countries are embarking on their UHC reforms, and young people need to play a larger role in that. And this gap is what my leadership project seeks to address. And so, I am excited to introduce my project, which focuses on doing things differently by intentionally including young people in UHC reforms in Africa. Our pilot program will begin with a cohort of 12 young professionals under the age of 30, both male and female, with the goal of amplifying their voices, strengthening their skills, and creating structured pathways for meaningful policy engagement. Our theory of change is simple. When young people are informed, mentored, and connected to real policy spaces, health systems become more inclusive, effective, and also sustainable. And so, to ensure that the project responded to the real needs, we conducted a baseline assessment, engaging both policymakers and young professionals. And we found that youth are highly motivated with moderate but uneven UHC knowledge. While they understood core concepts and challenges, there were notable gaps in governance and accountability knowledge. Most importantly, youth consistently described their inclusion in policymaking as minimal and often tokenistic. They are often consulted, but rarely invited to the decision-making table. Young people are, however, highly interested in advocacy, research, and policy engagement, and will highly benefit from improved capacity and exposure to decision-making platforms. And the findings revealed a clear picture. Young people are not disengaged, they are excluded. And so, as highlighted in this quote, young people could contribute more effectively if they had stronger policy literacy and exposure to real decision-making spaces. And so some of the key challenges identified include lack of mentorship, limited access to policymakers, power imbalances, and ageism. In response, the participants identified solutions centered on mentorship, capacity building, and structured platforms for their engagement. And so using these insights, we designed a project model with 4 components: a baseline assessment, capacity strengthening, mentorship, and exposure to policy spaces. And these respond to the identified challenges from our baseline assessment. Since June, we've recruited participants, we've completed the baseline survey, and mapped UHC knowledge gaps, and begun linking participants with mentors. Over the next 8 months, we will support them to develop their career plans, strengthen policy literacy, build networks, and engage directly in policy dialogue by creating enabling mechanisms in partnerships with policymakers and other organizations. Our expected outcomes include that there will be improved UHC literacy, increased confidence, documented youth-led policy contributions, and evidence of meaningful youth influence on universal health coverage reforms and processes. In summary, this project identified a way to do things differently for a different outcome while applying evidence and leveraging partnerships. Reflecting on the lessons that I've learned from this project, for me, I would like to highlight a reinforced core leadership lesson, which is that leadership is about recognizing opportunities and intentionally creating them for others. It also highlighted the importance of authenticity for me and building partnerships. As I drew from my lived experience and values and leveraged my networks to develop these partnerships, which enable the ideas to bear influence. And this reflects the quote that the power of an idea can change the idea of power. Our next steps in the coming months is to formalize these mentorship linkages, secure platforms for youth participation in policy dialogue, and ultimately scale this model, applying lessons from this pilot across broader contexts. Thank you so much for listening, and if you're interested, I look forward to partnering with you on the next phase of this project to advance the practice of doing things differently for effective policy outcomes.